Our Zimbabwe's health system is in a deplorable state. It's forcing citizens to flock to their neighbours for better treatment. As the country heads towards elections in August, many are hopeful things will change. Let's discuss this now with former president of Zimbabwe Hospital Doctors Association, Dr. Peter Magom-beyi. Doctor, good morning and thank you very much for joining us.
Thank you, Fundo, for having me. Thank you, our viewers.
No, it's a pleasure to have you with us today. So, in a few months, Zimbabwe takes to the polls. The public health system, particularly the health sector, is said to be in crisis. We don't know how much of that can be attributed to the current crop of leaders. But what we do know is that a great number of your citizens are flocking to neighboring countries for treatment. What exactly is at the heart of this situation that Zimbabweans are facing now?
What's happening to Zimbabwe is very sad. The health system is crashing. The health system has long collapsed. And as we speak right now, the largest hospital in Zimbabwe has got one working maternity theatre. And there's only one working ambulance at a central hospital. And if you go to United Bulawayo Hospital, there's only one CT scan machine, and patients, they have to wait for weeks to have a CT scan done. And at Harare Central Hospital, where I used to work, there's only 4 working dialysis machines, 0 at UBH. So patients, they have to actually be ferried to Mpilo Central Hospital for dialysis. You know, the situation is very bad. And most of the patients, they actually die in the process of waiting. That's how sad the situation is. And the healthcare workers, they're far much less underpaid. A medical doctor is paid close to $300 US, which is close to 6,000 rand per month. Nurses, yes, a medical doctor. And nurses, they're far much less underpaid for the great work they do to save lives with minimum equipment and more of improvising in their daily patient care. That's how bad it is.
So what do you attribute this inability to deliver basic services to? What exactly went wrong?
It's poor governance. The fish is rotten from the head, you know, and unfortunately it is the common Zimbabwean who has to bear the burden of this mismanagement. And as if that is not enough, those in power, they've come up with legislation that are not in keeping with modern day labor practices anywhere in the world. Bills that seek to deprive healthcare workers of their right to go for industrial action and collectively table their labor disputes. All this is to silence the cries of healthcare workers and other civil servants who are simply asking for a fair living wage and fair labor practices. But what we have seen now is a massive exodus of healthcare workers and other Zimbabweans to neighboring countries. Overburdening other healthcare systems, especially South Africa. And it's very sad that if I tell you that when I was at a local hospital here in Pretoria, it's Steve Biko Academic Hospital, I happened to meet a very sad Zimbabwean lady who was supposed to go for heart surgery because there were no services in Zimbabwe, and she had to come here in South Africa for the heart surgery. Here she was. She didn't have valid documentation here in South Africa, and now she's stuck between a hard surface and rock, you know, and she couldn't have the heart surgery done. You know, I could see the fear in her eyes, you know, as she could see other patients being ferried to theatre, getting their surgeries done and carrying their bags going back home. I could see the fear in her eyes.
My goodness.
You know, I could see the desperation in her spirit. And you know, what makes it worse is every time I could visit the cardiology unit, she could ask me, so doctor, when do you think I'm going to have the surgery done? You know, it's really sad to see one of your own dying in such a manner. You know, then I thought to myself, this could be me, or this could be, I mean, roles reversed, this could be me, or this could be the president himself, this could be any of the government officials themselves.
But citizens have an opportunity to make a change. August, they're going to the polls. But we understand that there is a repressive political climate currently. We know that dissenting voices are being persecuted, at least that's reports coming out of Zimbabwe, and that there's generally a curtailing of freedom of expression or association. Is this in fact something that you know of?
Definitely, I'm actually a victim of such governance. When I came here in 2019 as a refugee here in South Africa, these are the issues that we were raising. You know, we are not coming up with something from the blue, but when we raise these issues, we were called names by the government, puppets, traitors. You know, unpatriotic. But then you would ask yourself, is this patriotism, this rampant looting and corruption, I mean, looting of funds that are meant for the public for personal gains? Surely not.
Mm-hmm. What should be the region's role if we're talking about SADC leaders? What should be their role in assisting Zimbabweans? Because constantly you guys are vocal about the situation there, but then you see presidents, including ours, being very cordial with your president, as is expected. But what should be the role?
This is the point in time where we have to call a spade a spade. This is the time where I feel like the sister governments should tell each other the truth. Because in as much as we try to be diplomatic about the situation, Zimbabweans will keep on flocking to South Africa. They don't have an option. They will come where they think the greener pastures. They'll keep on coming here. So this is the time where I think President Ramaphosa has to tell the other sister party, ZANU-PF, to do the right thing for the people. You know?
Mm-hmm.
Yes.
So the silence is not in the best interest of the region. Mm-hmm.
Correct, that's correct.
And then what would be your message to the President Mnangagwa currently?
Mr. President, Zimbabweans, they've suffered. Zimbabweans, they are burning from the back. Zimbabweans, they're burning from the front. We don't know where to go. Our lives as youngsters, our lives as youths is bleak. We don't know where to go. And our situation is very desperate. Our situation is very precarious. And we kindly ask you to change our situation. We know that if you want and if we find favor in your eyes and if you find it in your heart, you can change our situation for the better and give us the Zimbabwe that we have always wanted.